2, 1. Good afternoon, everybody. Welcome to this media availability where we will be discussing the revisions to the executive orders related to the pandemic. The council has just finished its vote, and I will turn it over to Council President Tom Hucker for some remarks.
Thank you so much, Ms. Kennedy. Good afternoon, everybody. Thank you for joining us at this briefing. I'm very pleased to be joined by County Executive Elrich, Vice President Gabe Albornoz, and Council Members Glass, Giwando, Katz, and Rice, and Friedson. Did I miss anybody? I'll announce them. And Dr. Stoddard is here, and Dr. Bridgers from HHS is here. That's terrific. Thank you all for joining us again. We have lots of experts to answer your questions. 3 days ago, during Tuesday's council session, we held a commemoration recognizing Montgomery County's one-year battle with COVID-19 in remembrance of the 525,000 American lives that have been lost and the over 1,400 Montgomery County residents whose lives were lost due to this deadly virus. We honor the many more who have been hospitalized and continue to suffer from the impact of this virus. I would like to play a video from that commemoration.
Pulling up the video now.
Warm greetings to you all. My name is Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health in Bethesda, and Chief Medical Advisor for COVID-19 to President Joe Biden. I am delighted to have this opportunity to congratulate and thank the County Council and community leaders of Montgomery County who have worked so hard in responding to the COVID-19 pandemic on behalf of people who live and work in the county. With the recent emergency use authorization of a third COVID-19 vaccine by the Food and Drug Administration, we are well positioned to bring this historic pandemic under control if we all just hang on a bit longer. Now is the time to keep our foot on the accelerator with regard to adherence to public health measures such as masking, physical distancing, and other measures that we know work to protect people from the SARS-CoV-2 virus, while we are ramping up efforts to vaccinate as many people as we can as quickly as possible. Using both strategies in tandem is the most effective way to quickly reduce the level of virus in the county and thwart new infections. We are all in this together, and working together is how we can end it. Thank you for supporting NIH. Stay well and keep up your outstanding work.
You're muted, Mr. Hucker.
As you just heard, Dr. Fauci didn't just congratulate us, he instructed the Montgomery County Council and the public to keep our foot on the accelerator while we're ramping up efforts to vaccinate as many people as we can as quickly as possible. And Dr. Fauci's not the only top medical official who feels that way. A few days earlier, the director of the CDC, Dr. Rochelle Walensky, said, "Please hear me clearly. At this level of cases with variants spreading, we stand to completely lose the hard-earned ground that we have gained. These variants are a very real threat to our people and our progress. Now is not the time to relax the critical safeguards that we know could stop the spread of COVID-19, not when we are so close." So this is a very difficult time to make public policy, and I'm very grateful for clear instructions from our nation's top and highly respected public health leaders like Montgomery County's own Dr. Fauci and the CDC's Dr. Walensky. But despite those clear professional medical instructions, just a few hours later, Governor Hogan announced that the state would lift the COVID restrictions. In the last 72 hours, the county has been assessing our options to respond to this decision. And after deliberation with our top health officials, we agreed a Board of Health regulation was the best way forward for Montgomery County. For context, I'll remind everyone, since the onset of this pandemic 1 year ago, Montgomery County has adhered to the guidance from our team of nationally recognized public health officials, Dr. Raymond Kroll, Dr. Travis Gales, Dr. Earl Stoddard, and Dr. James Bridgers, who have continuously recommended putting public health first and recommended measured, rational steps toward reopening so we don't cause another surge in cases. That's an approach that reflects the unique challenges we have in Montgomery County, challenges that many other counties don't all share. We have historically taken more protective measures than other jurisdictions in the state for several reasons. One, we are the most populous and diverse jurisdiction. Two, we have the highest number of seniors, and we have the highest number of eligible residents waiting to get a vaccine from the state. And now, recently, we know we're the only county in the state where all 3 variant strains have been detected. But despite those factors, along with other large jurisdictions, we've consistently received fewer vaccine doses per capita than other jurisdictions. For all those reasons, it's our job to do what's best for Montgomery County residents, and that means taking more protective measures. Juan, do you have a slide for us? Thankfully, our cautious measured approach has brought our case numbers and hospitalization rates and COVID deaths down significantly recently. And we're in a much better position now than many jurisdictions in the state, as you can see on this map of case rates by county. So what we've been doing after much effort is working. And that's why, as Dr. Fauci and Dr. Walensky said, now is not the time to loosen restrictions significantly and risk another surge, particularly while we're reopening schools, which introduces more risk of community transmission. We all want our children back in school safely. We all want our businesses open safely, and we all want life to return to normal as quickly as possible. And we will continue to ask for our fair share of vaccines from the state and for a mass vaccination site in Montgomery County. The fastest way for us to reopen safely is for the governor to give our health department our fair share of vaccines per capita, the same number per capita as other small rural jurisdictions. We'll continue following the data and taking a measured approach to reopening that's tailored for Montgomery County residents. Today's regulation allows us to get our students and our teachers back in the classroom safely, to expand our business opportunities and restore recreational and social activities in a way that doesn't unduly jeopardize public health. As the Board of Health, we will assess the medical data daily, and we'll review this policy every 2 weeks going forward. And it's very helpful for us to have a different path than most of the state because it helps disaggregate our medical data from other counties to measure the effectiveness of our order. So today we're taking another step on the road to reopening by approving a new Board of Health regulation. And the details are here on the slide. We're aligning our outdoor dining with Maryland's Department of Health guidance while indoor dining capacity remains at 25% until March 26th, when it will increase to 50%. Second, childcare will return to group sizes and staff-child ratios in accordance with Maryland regulations. Outdoor gatherings have been increased to 50 people or less, and indoor gatherings have been increased to 25 people or less. Retail establishments and businesses such as fitness centers and hair or nail salons, as well as museums and art galleries, can now operate at 25% capacity. Houses of worship can conduct services at 50% occupancy, and sports played outside can now occur with 50 people or less, and indoor sports activities can be played with 25 people or less. Next slide. On March 26th, capacity limits will increase to 50% for indoor dining, retail establishments, personal service facilities, fitness centers, bowling alleys, escape rooms, museums, art galleries, and pools. And also on March 26th, theaters, social clubs, and all admission and amusement venues can reopen at 25% capacity. This balanced approach maintains capacity limits because COVID-19 remains a real matter of life and death. And as elected officials, we were sworn to protect the people we serve. We all have an obligation to keep our residents safe. We take that very seriously. Our residents expect us to take the advice and the guidance of our top professional medical experts. Fighting COVID-19 and recovering from the loss and devastation that this virus has caused is our top priority in upholding our promise to protect our residents. The most important thing we can do right now is get vaccines into residents' arms, and the faster the governor gives us more vaccines, the faster we will deliver on that promise. We cannot relax restrictions, though, and let our guard down until more of our residents are vaccinated. And for that reason, we continue calling on the governor to send more doses to Montgomery County and open a mass vaccination site. Thank you all for participating today, and let me turn it over to County Executive Elrich.
So thank you all for having this event, and I'm really glad that you all were able to get your work done this afternoon so we could prepare this. It is very hard for all of us to try to react from Tuesday afternoon to something we have to reach a conclusion about at 5 o'clock on Friday, actually before 5 o'clock on Friday. So our folks, and I want to thank my team for this, have worked overtime trying to create parameters and do the analysis needed to help guide a path forward for Montgomery County. I would, agree with pretty much everything Tom said. When the governor made his announcement, it came on the heels of Dr. Fauci and the CDC saying, don't do it. And if I had to make my decision based on whose advice to follow, I'm following Dr. Fauci and the CDC. It is ironic a little bit because we were preparing a memo to the council, which would have provided additional openings for the council to act on. It was more measured. At the same time, the governor was doing what he wound up doing that afternoon. I think it's very unfortunate. We all understand that every time we open a door and every time we increase capacity, we increase risk. It is impossible to do those things without increasing risk. And we know the consequences of risk, illness, and in the worst cases, death. And we've been very careful about this throughout this whole pandemic. And as Tom showed a couple of slides up, the county, I hate to say, has done very well. The county has done better than many other jurisdictions, particularly large jurisdictions, and we compare well nationally. But comparing well nationally or even locally doesn't mean that you're doing well. And our cases, particularly the number of cases per 100,000, is still twice what it was at its low point during the summer. So while we've come back from the third peak, we've made good progress against that, and our test positivity has been pretty good. We still have more cases per 100,000, and that tells us that the infection is unfortunately alive and well in the community. The last 2 days, after several days of being under 100, our case counts have been slightly over 100. So we are not out of the woods yet, and we have work to do, and that's what this press conference is about today, is Montgomery County's continued to be determined to do the work we need to do. We are not going to open up and create greater unsafety or greater danger for the residents of Montgomery County. We all understand that our decisions really are life and death decisions at the end of the day. And we need to make decisions that we can ensure will keep the bulk of our residents healthy. We have made great progress on vaccinating people, but we still have about 800,000 people unvaccinated in the county. That's a lot of people to expose or to invite more exposure to of the virus. And while we're all waiting for more doses, those doses aren't here yet. I just looked at this week's allocation. It came in just before this press conference started. While they increased the allocation to the county health department, when I added up the hospitals and the pharmacies and everybody else, the total vaccinations coming to the county are actually smaller than they were a few weeks ago. And we still don't have a mass vaccination site. We think we're making progress on that. But until we have it, it creates a great disparity in this county. So we're hoping that we can move quickly on that. We understand the shortage of doses. This is still, it's not the governor's problem. The doses aren't there. We had initial doses of Johnson & Johnson, and then everybody was told there will be no doses for 2 weeks. And so they gave us what they had produced. And now we have a 2-week period. We're in a 2-week period when we don't get additional Johnson & Johnson doses. Moderna and Pfizer have talked about ramping up production. There's much publicity around a partnership for production, but those doses also have yet to arrive yet. So our view is basically the governor's order is premature, that we are on that path. We fully hope to get to that path. As more of our residents got vaccinated and our cases came down, we would have continued on our own to continue opening things, but we were not there yet. And, at the end of the governor's comments that day, he talked about what he was maintaining, and he was maintaining the masks and the physical distancing. And that all sounds good, but it is in contradiction to his decisions to open up restaurants and to open up theaters. because both those venues involve food. And we know that these are the venues where the masks come off, because you can't eat with a mask on. And anybody who's been inside a restaurant knows that people don't take a bite and slap the mask back on, and then take another bite and slap the mask back on again. So these are two venues where the protections that he recognizes as being critical, protecting everybody's public health, don't actually work, because people aren't actually able to do both. And those are probably the loosenings that concern me more than anything else, because if people go back to restaurants in numbers and they're in rooms where people are not keeping the masks on 100% of the time, that does expose more people to COVID, and it does threaten the spread of COVID. And if you're reading the headlines about particularly the Brazilian variant, Brazil set a record for deaths 2 days ago, over 2,000 2 days in a row. And they're very worried about the spread. The Brazilian variant is in Montgomery County. We should not be risking putting the spread of this virus ahead of the spread of our ability to vaccinate people. We would prefer to be ahead on the vaccines so that we cut off the avenues that the virus has for spread. We were not ready yet, and I want to thank the council for the action they took today, because I think this sets us in the right direction. We've used the authority that remains to make this decision, and I think we've made a good decision, and I'm confident that we'll continue to measure this as we go forward. Like I said, we were going to prepare to reopen a few things, or open things more, I should say, this week before the governor even made his announcement. So we were understanding there's a path toward reopening, and this gives us the tools to continue on that path in a measured and careful way, and to put the health and safety of our residents first.
Okay, thank you. I want to call on my colleagues, but I want to just say first how proud I am of the council acting as the Board of Health today. Each and every one of these members dropped what they're doing, focused on this for the last 72 hours, and despite very difficult circumstances and hearing from people all over the county, came together to pass this regulation unanimously and to send a very clear and strong signal that our job number one, our top priority, is protecting the health of our residents. Council Vice President Dave Albornoz.
Thank you, Mr. President. You and the county executive laid it out well. I am proud of the steps that my colleagues just took. As has been noted, we are not out of the woods. And it was just a couple of months ago that our hospitals came dangerously close to reaching capacity. And so we must ensure that we learn from past lessons and not make the same mistakes twice. We have to continue to adhere to the science and the guidelines and be diligent. All of us have a role to play in ensuring that we keep not just ourselves and our families and our friends and our neighbors, but our entire community safe. And so while it's unfortunate that the governor's decisions put us in a very difficult situation, not surprisingly, our community has stepped up, and we are moving forward in a very cautious and diligent pace. I'll say this bilingually for our friends in the Spanish media that I know are on as well. Hoy día es un día bien importante. Esto representa el próximo pase de donde estamos con la pandemia. Desgraciadamente, el gobernador nos puso en una posición bien difícil esta semana y ha dado el mensaje de que podemos avanzar como una comunidad entera, pero la realidad es que el virus todavía está aquí y todavía tenemos que tener mucho cuidado. Así que los reglamentos que pasamos hoy día sí nos mueve adelante, pero tenemos que asegurar que tomamos la meta que todavía el virus está aquí dentro de nuestra comunidad y tenemos que tomar pasos en una manera que significa que todavía está aquí. Gracias.
Thank you, Gabe, and thanks for all your hard work on this. Other council members, can you signal me if you want to speak? Okay. Great. Back to you, Susan. We'll see what questions people have.
Okay, before we start, Dr. Bridgers has alerted us that Dr. Gales is on the line via
Thank
call.
you.
So if anybody has questions for him, he is here. The first question today is from Jordan Lindsay from MCM. She has a question for the county executive and Dr. Stoddard. Jordan?
Thank you so much. So I wanted to know, bouncing back to vaccinations, I wanted to know any word on updates on the mobile vaccination clinic for seniors who are homebound, and then also too, anything on word on vaccinations for people on the homeless population in Montgomery County.
I think I'm going to let Dr. Gales answer that on verbally if he's there.
So Jordan, I can respond
Okay.
as Dr. Gales joins the call. So we've dedicated doses for our homebound individuals. We have a great pilot with one of our community partners to vaccinate our homebound community, and we've also allotted vaccines, the Johnson & Johnson vaccines for our homeless and indigenous population. We began vaccinating 3 shelters this week, and we will continue to support that effort. We've also identified, in addition to your questions, with identifying those individuals who may be hard or harder to reach, our Department of Correction detainees as well. So we're using and we're reaching out to those populations as a safety net vaccinator, and we'll continue as best as we have with our J&J doses. We only received 1,600 doses, and those doses are almost gone, and we won't get another allotment for a couple of weeks. Dr. Gales, if you're on the line, I will turn it back to you.
And I also had an update question once Dr. Gales answers that. Any updates on the mass vaccination site in Montgomery County?
Yes, so I don't hear Dr. Gales answer. I do know also on the homebound, I believe Dr. Gales reported to it in another meeting earlier saying we've done 60 doses through the pilot already. I think we have a couple hundred that are with that. Oh, I see him lighting up. So Dr. Gales, go ahead. Oh, maybe not. I'll continue. Yeah, I think we have another couple hundred for with the nonprofit that we've been working with the health organization we're working for with the in-home bound. A couple hundred more vaccine doses, and look to expand that program moving forward.
Thank you. And then do you have any updates on a mass vaccination?
Yeah, we are going to do a walkthrough with the state over the next week or so. And once we do conduct that week walkthrough, I'm sure we can report back on sort of where the feedback is. That walkthrough will be with the Maryland Department of Health and will include elements from the National Guard, is my understanding. And so once we conduct that walkthrough, they'll help us understand exactly what logistics that we need to work on to get the site ready to go. The state will not, and the state has not said no. The state has also not said yes, just so we're clear. And they're focused on, and obviously they've got another mass vaccination site that launches in they have one in Western Maryland that's launching and one on the Eastern Shore that's launching. Once they get those 6 up and running, they will be in a better place to discuss vaccine dose dependent additional sites across the state. Our hope is that we give them a site they cannot turn down.
Did you have a site location? This is the last question. Site location, a specific location that you can name?
Yeah, we're really working closely with our Montgomery County Germantown campus. Obviously, it's a large enough campus. The nice thing also from a state perspective is that it's on 270, easily accessible from residents of Frederick County and other counties north of us. And so it offers an attractive site for the state to really broaden its efforts in the central Maryland area. And so that's the site that we're currently focused on. We've also had discussions about the Montgomery College Tacoma Park campus. We may utilize some of these other spaces for county clinics moving forward as well. So obviously not just mass vaccination site, but we are focusing right now with the state on the Montgomery County Germantown campus.
Thank you.
Just to be clear, Montgomery College Germantown campus.
Sorry, yes, my apologies. Montgomery College Germantown. Thank you, Councilmember Jawanda.
Thank you.
Okay, our next question comes from Carla Flores from Telemundo for Vice President Albornoz. Carla?
Hi there. Buenas tardes, señora Albornoz. Yo sé que dijo un poquito acerca de lo que se hizo, pero quería preguntarle por qué se dio la decisión a la Junta de Salud y no normalmente el Ejecutivo tiende a decidir por órdenes ejecutivas, pero ¿qué fue el cambio que hubo hoy?
Buena pregunta, Carla. Como
nosotros tenemos la capacidad cuando iniciamos estos órdenes para estar seguro que los municipales son parte del orden. Así que Gaithersburg, Tacoma Park y Rockville ahora son parte de este orden. ¿Sí? El Ejecutivo, sin tener ahora la capacidad por lo que hizo el gobernador esta semana, no podríamos asegurar que los municipales serían parte del orden. Así que por eso que lo hicimos como una junta y como el consejo.
Y otra pregunta, o sea, si no hubiese sido por la decisión del gobernador de levantar estas restricciones, ¿ustedes hubiesen tomado este tipo de acciones para que empiecen hoy día o se vieron forzados a hacer algún cambio por la decisión del gobernador?
No, sabes que íbamos a tomar estos pasos, pero ahora lo estamos haciendo como una junta, como un consejo, en vez de hacerlo como parte del Estado. Así que íbamos a tomar estos pasos, pero ahora se complica un poquito más porque cada parte de la región va a tomar los pasos de ellos mismos. Así que vamos a tener que trabajar con Prince George's County, con Washington, D.C. y con otras partes de condados que son vecinos del condado.
Perfecto. Y por último, ¿cuál sería el mensaje que le envía a la comunidad hispana sobre pues estas restricciones y el camino que se dirige el condado Montgomery?
Todavía hay que tener mucho cuidado porque el virus todavía está aquí, la pandemia no se ha acabado. Tenemos que seguir moviendo adelante, poniéndonos mascarillos y también tomando los pasos dentro del orden hoy día. Si hacemos esas cosas, los números van a seguir bajando. Ahora que tenemos más vacunas, también es bien importante que la gente sepa que la vacuna es bien saludable y por favor, cuando tienen la opción de tomarlo, que lo tomen. Así que las cosas han mejorado, pero no estamos ahí al final todavía.
Perfecto, muchas gracias.
Thank you. Our next question is from Alex Flum from WDVM. Alex?
Hey, I hope everybody's doing well. I just had a clarifying question about the decision about sports. I know you guys said 25 limit for indoors, 50 limit for outdoors, and I know MCPS Athletics has kind of planned out the schedules for all the sports and said it's kind of up to what the county decides, from my understanding. So as of now, with this official decision today, with what you guys have put through today, are county sanctioned high school sports going to be allowed to be played in terms of, you know, soccer, field hockey, volleyball, all that? And then where does football stand with all of this?
Okay.
Well, I can't speak specifically to MCPS sports. I can say generally what we've done today is enhance the capacity both for indoor and outdoor sports. And we added an additional amendment, which is important. We now have a formal process that specifically calls out youth sports so that they have an opportunity to file for a letter of approval. Because as we all know, each sport is different, the level of contact is different, the field of play is different. And so we want to not have a one-size-fits-all approach and at least give sports the opportunity. And now with the specific provision of youth sports, it puts us in a better position because we've been impressed with the plans that have been put forward by many of the sports associations that are out there. And Dr. Stoddard and Dr. Gales and Dr. Bridgers and their teams review these as quickly as possible, turn them around as quickly as possible. And it's a two-way street. There's often collaboration so that we can address the concerns that they may raise so that we can get everyone back on the playing field as quickly as possible.
So just to follow up real quick, so would the sports that are, you know, scheduled to happen with MCPS Athletics on the 19th, that's everything except for football, you know, are they now allowed to be played? And then what about, you know, on the 26th with football?
I'm going to have to refer a little bit to Dr. Stoddard. He may be in a better position to describe because he's been more in collaboration with MCPS Athletics.
Yeah, so I'm looking at an update that Dr. Sullivan from MCPS System-Wide Sports is going to release today. I believe that they've, you know, looked at the county health Board of Health's order and will be issuing a sort of statement on what their rules will be for individual activities. I will also note that given the amendment that was added to the Board of Health regulation, allowing for us to look more closely at a sport-by-sport determination, we will be working closely with MCPS on individual sport exceptions to the gathering limits based on, and so I don't know that we can say exactly what each sport's going to be permitted to do today. I do think it is our goal to allow sports where, for example, if they need 27 or 35 on the field as opposed to 25, we will be looking to the maximum extent possible to allow them to proceed with those sports. Now, when it comes to the high-risk, high-contact sports like football, I think it's a little bit more of a complicated decision. I certainly don't think we want to preclude ourselves from saying that we would absolutely consider some of those things, but at the same time, we're going to have to look very closely at those, and I would not necessarily assume that all those activities will proceed as they would in other years. I would expect to see the MCPS update go out later today. It is dated March 12th, so I would expect you'll see an update from MCPS Athletics later today.
Thank you, guys.
Thank you, Alex. Our next question is from Chris Gordon from NBC4. Chris?
Thank you very much. This question is for County Executive Elrich, but council members may want to answer it as well. Councilmember Joando said during the discussion, what Governor Hogan did this week was irresponsible, reckless, and politically motivated, in his opinion. It appears that there's growing tension between Montgomery County and the state, and that this was a rebuke of the governor. What would you say to that?
I guess, that there's always this effort to portray this as a Montgomery County issue. I'll point out that Prince George's County did basically what we did. Baltimore City did basically what we did. Anne Arundel County did some of what we did in terms of at least capacity. We have had disagreements among, a number of counties for as long as this has been going on, particularly when the governor diverged at some point from what I thought was, he had really strict guidance, which he had early on given. And when that started loosening up, and then from that point forward, I guess they call them the Big Seven counties, and sometimes Hartford, we had started to be more cautious than the governor's advice. And I take comfort in the fact that, not only my health officer takes this position, but they just published an op-ed. All the health officers published an op-ed in the Baltimore Sun. So I'm pretty confident that we're following the advice of the health officers more closely. I know the health officers don't feel they're being listened to. I know there was no discussion with us, the county executives, prior to this decision, much as with other decisions that have been made. So we haven't had an opportunity to give input or express concerns, which I wish we had had. And I know the health officers feel equally unconsulted. So this is not a Montgomery County governor thing. This is a little bit broader than that. And I just think it's unfortunate. We should be following the advice of the health officers. And if the majority or the bulk of the health officials, and I don't count the person who came from the Trump administration, if they're the ones telling us to be careful, that's the advice we should be following.
Chris, the only thing I'd add is health officers, as you probably know, are state employees. And so it sort of begs the question, why have health officers at all at the county level if you're going to routinely disregard their advice? I'm happy to send you a letter from 33, I think it was, county execs and council presidents, largely asking for much of what we discussed and what we prioritized today. And so far, the Maryland Department of Health has rejected nearly everything that we asked for in that letter. And that's not from me or from the county executive. That's from 33 of our colleagues all across the state.
All right. Well, Mr. County Executive, you said that other counties diverged from or separated themselves from the governor. But do you feel that the governor, in announcing Tuesday that he was lifting these restrictions Friday without consultation, without even informing you, that it was irresponsible, reckless, and politically motivated?
I think it's part of how he's handled this. I mean, I don't know any other way to say it. This is not he didn't suddenly not consult us. He has not talked to the county executives about any of these decisions for months and months and months and months. I'm concerned, if the person's running for president, then he's worried about his base. I don't know that doing the things that he was doing in Maryland necessarily comport with his base. When I think about who I get comments from, when I look at my public comments, they often come from people I would identify as part of that base, so to speak. He's certainly not addressing the kind of comments I get from residents who say, please keep us safe and please be careful. So I'm not thrilled with this. All of us in the executive positions and unfortunately, the health positions, which I feel worse for because they're professionals in this area, have not been consulted in a part of these decisions. That's not good.
Chris, I'll just add, since you quoted me there, just briefly, obviously I believe it, but here's the point to Council President's point about the health officers and the county executive. It's just not, it doesn't make any sense. You all just sat through that long session and we had to work all week. You would, if you wanted to roll out properly, even if you believe that's the right strategy, you would tell the health officers from across the state. It's not just Montgomery County, but we are the largest jurisdiction and we're elected to represent Montgomery County. So that's our perspective. But there's others who took, as the county executive pointed out, took different action. You would at least notify your state employees and not have us finding out at the press conference, which is what is happening. And I would put this one a little differently than others, because this is going to happen at 5 p.m. this week. And good luck figuring it out. And then we had to figure out what our legal responsibilities were, how we were going to protect the health of our residents, and do all that on the fly. It just, regardless of whether you agree it's the right policy or not, obviously we don't. We took different actions because we wanted to follow the advice of health professionals. So that's why I said it's reckless. And it causes confusion in the public, and they don't know what's what. And that's really not fair to residents of Maryland. We represent 1/6 of the residents of Maryland. So that's why I said what I said.
And look, Chris, there's no way that you can open things up, particularly if you're going to talk about restaurants and theaters with food, knowing that these are the places that, the CDC has called these places out explicitly because of the danger of being in a place with unmasked people. These are two, he could have done everything else. If you ask me about department stores and about going into retail, because my experience has been every time I go into it now in Montgomery County, everybody is masked and people seem to actually be having the mask over the top of their nose instead of under their nose. I feel much better going into a retail environment, but there is no way to avoid unmaskedness in a restaurant. And if movie theaters serve food, there's no way to avoid unmaskedness. And 6 feet doesn't mean anything once you're unmasked. So if he had done some of the other stuff, I probably wouldn't have had as much heartburn over it. But he did two things which we know will increase the spread of the virus.
Thank you.
Thank you, Chris. Our next question is from Luis Hernandez from Univision DC for the Council Vice President. Luis.
Thank you so much. Concejal, si por favor nos puede dar a entender muchos de los espacios que van a tener un aumento de capacidad, como las iglesias, restaurantes y centros, van a tener 2 semanas para prepararse. Ustedes como concilio van a trabajar con ellos para que estén listos para estas 2 semanas y estén listos para toda la gente que va a acudir.
Buena pregunta, Luis. Sí, definitivamente queremos trabajar con nuestras empresas para que están listos de promover las reglas que pasamos esta tarde. Y si necesitan ayuda, pueden llamar al 311 y al condado. Nosotros hemos estado trabajando con diferentes empresas desde que ha empezado la pandemia. Si necesitan ayuda en diferentes maneras o si tienen preguntas, nosotros tenemos oficiales que pueden visitar a estos restaurantes para trabajar juntos para asegurar que todas las reglas se pueden mover adelante.
Una pregunta más última. Ahorita, repitiendo un poco lo que dijo el Ejecutivo en cuanto a que no se han comunicado, el gobernador no se comunicó con ustedes, con el concilio, con el Ejecutivo. Nomás realmente estresar el hecho de que no hubo esa comunicación por parte de este gobernante con ustedes.
Sí, eso fue lo más difícil de lo que hizo el gobernador. No llamó a nosotros antes de que anunció que iba a mover tan agresivamente adelante con las reglas del Estado. Es ridículo que no hablaron con los oficiales de nuestra Oficina de Salud Público y que nosotros supimos como resto de los residentes del Estado cuando él anunció qué es lo que iba a anunciar. Eso es un problema. Tenemos que mejorar la comunicación con la oficina del gobernador porque es sumamente importante, especialmente en este momento que trabajamos juntos.
Muchas gracias.
Thank you, Luis. And a quick clarification from Caitlin Peets from Bethesda Beat for any official. Caitlin?
Hi, thank you. I just wanted to make sure that I am understanding correctly. I know that there was some testimony asking for the face covering requirement during athletics to be removed, but that was not something that was removed today, correct? Face coverings are still required during athletics?
Correct. Face coverings are still required during athletics.
Thank you. And I guess if I have time for one question, I mean, you've talked a lot about how the governor's announcement on Tuesday and the impact of his new order kind of sent you guys scrambling to figure out what your authority is. Can you maybe just kind of walk us through what that actually looked like? Like, how much did you meet and how much went into that discussion that the public didn't get to see?
I don't think it was a whole lot. I mean, from our perspective, he rescinded our authority. We spent some time looking to see whether there was alternative authority. We had a discussion about that and eventually arrived at the conclusion that the cleanest way to do it was to use the county council acting as the Board of Health, which had the least restrictions and the most freedoms to make decisions like this. So it was pretty straightforward. It did take lawyers a bit of time to unscramble that, but you could measure that in hours, not in days. Obviously, we're sitting here Friday afternoon now, acting on something that we found out about on Tuesday. So we got the information, we figured out the legal stuff, we started thinking about what guidance we'd be interested in. We passed that on to the council. They did their deliberations. They voted today. I think we did a remarkably quick job with this. And I just want to thank everybody for putting their full attention. And the governor did give us this 5 p.m. deadline that we had to act under.
Caitlin, if I could just add to that, one of the things as chair of the Education and Culture Committee, I'm responsible for our arts and humanities. And so I immediately, when the governor made his decision, have been talking to Dr. Gales and also reached out to Susan Jenkins, who's the head of our Arts and Humanities Council, and talked to them directly about what this might mean for them. And we came up with a discussion plan about what's going to happen in terms of how these organizations can actually realistically open. Many of them have been closed for over a year. And so from that perspective, hiring back employees, getting uniforms. For example, if you're working at a theater, you have to order uniforms, you have to order supplies, even if it's not food. There are so many other things that need to be there, the tickets and the paper that needs to be printed for some of those. All of that stuff isn't just sitting around anymore, right? And so those are the kinds of things logistically that go into, and it's a reason why we came up with an idea, all in negotiation, of what it might mean to do it 2 weeks from now, right? And start that as the effective date, understanding that there's so much ramp up time that's needed to be able to make sure that they can start this process and really start an incremental approach to reopening. And so this is beneficial to all, because what we did here, you'll remember when we had the last governor's order that opened up restaurants to do indoor dining right before Valentine's Day. And you heard many restaurants talking about the struggle of trying to react so quickly to something that had happened on a Friday, and Valentine's Day was that Sunday, and how challenged they were. And it actually made it hard for them. And so having this advanced amount of time actually is going to be a good thing. And so that's why what the council did in terms of really picking a date that was date certain, but gave them a little bit of additional time to be able to plan and be able to get their logistics together, I think is going to be beneficial all around.
Caitlin, I might just add, regardless of how anybody feels about any element of the public health policy, and there are many different elements there and people can disagree with how many people should be allowed in a bowling alley. Regardless of that, I think every management professional, every communications professional, every professor of those disciplines in every college in the country, and every expert in the private sector, the government sector, nonprofit sector would all agree that large organizations don't work if senior management don't communicate major decisions to their own employees and major partners like a major county government. They get feedback and answer questions, but instead they just choose to skip that step entirely and go directly to the media to announce their decision. That's what causes this kind of confusion and anxiety among all the residents. And I think that's true, and everybody would agree on that, regardless of how they feel about any individual element of the policy.
Hi, this is Dr. Gale. Are you able to hear me?
Yes, we can hear you.
I just wanted to add another thing that's important to remember is that as we open up more businesses, we also put those employees of those respective places at risk because they are having increased contact with the public now, and they may not have had those opportunities over the last year. And so during this additional time, as we continue to look at the surveillance information to understand how the disease is continuing to spread with the variant strains, it also allows for more opportunity for those essential employees to get vaccinated and have adequate protection to protect as we open up more things and expect them to go back to work, to make sure that they have access to vaccines as well to be safe.
Thank you, Dr. Gales. Okay, our next question is from Timothy Young from WDVM to anybody on the council who would like to answer it. Timothy.
Thank you. How's it going, everybody? So my question is about some clarification near the tail end of the council meeting. There was discussion about some amendments being made at the next meeting on Tuesday. Can I get some clarification on what exactly those amendments would look like and what that discussion would be?
Well, I think I know what you're talking about. I'll just say it's not happening. I suggested that we would take up the hockey issue later because there was some, I wasn't clear on it. And I think that was the discussion. It did end up getting voted on. And now, along with the earlier amendment that Council Vice President Alvarez mentioned of a waiver process, now hockey will be able to, and I'll let Councilmember Glass explain it, but it was his amendment to have a slightly different regime for the indoor hockey. So that was that. So there's nothing being voted on Tuesday. The order is the order, and it's final as of today, and we'll consider it again in 2 weeks.
Got it. Thank you.
Timothy, did you need any explanation on the amendments that passed, or you're clear? I think that should be okay.
I do have one additional question, again, for anybody who wants to talk about it. I know that there was discussion on the impending spring break and St. Patrick's Day when it came to these kind of reopenings. Does anybody want to speak on what kind of, what those impacts would look like with the county with these kind of regulations being eased?
Dr. Stoddard.
Yeah, I mean, obviously our concern is that the message that was sent by the governor's actions is that COVID is over and you can go out and enjoy your St. Patrick's Day at a bar or restaurant to your heart's content. And I think obviously part of what the Board of Health has done is made clear that we just don't view it as mission accomplished for COVID in Montgomery County. And I think that's an important message to send to our residents, and so that they understand that there is still a risk and there still are, the virus does not care that 10% of our population has been vaccinated. That means there are many people who are still not vaccinated, who, if they gather in large numbers together in a close space, removing their face coverings, it is happy to bounce from person to person to person. And so we would encourage our residents over the spring break to not do extensive travel, and if they do travel, to take advantage of the many testing opportunities that we have in Montgomery County, to know your status when you return before you do major activities back in Montgomery County when you return. Obviously, if you come back and you wait 2 to 3 days to get tested, I think it's an excellent way for you to make sure that you're protecting yourself, your friends and family. And then on St. Patrick's Day, obviously, even as we go into this period where there will be areas, certainly not just in Montgomery County, but around Montgomery County that have increased capacity, just because something is permissible to do does not mean that you should take advantage of it to its fullest extent, nor does it mean that it's safe. So obviously, any environment where you have a large number of people without face coverings for the full extent of the time is a potential risk, and we would encourage you not to take advantage of those opportunities. If you want to celebrate St. Patrick's Day, there are plenty of ABS stores that provide wonderful beverages. You can bring it home and have it, have a wonderful celebration with your immediate family at home. And so there are options to celebrate the holiday, and we encourage you to do so. We just don't encourage you to do it with several hundred of your closest friends.
So I just want to add that, one of my favorite bar owners in Bethesda who wound up closing, when we were talking about what they were dealing with, spoke about the very thing that Earl was talking about, that how hard it was, even when we were allowing, which is why we actually pulled drinking back to 10 o'clock, is that even when we allowed it and we had rules and he told people what the rules are, it was virtually impossible to keep people from not taking their masks off, from not crowding around the bar. The governor said the 6-foot rule is still in effect. I suppose we could go out St. Patrick's Day night and enforce a 6-foot rule. That would probably mean nothing else in the county got enforced. That would probably be challenging. But I mean, this is a real problem, and it's a problem not just for the customers, it's a problem for the workers, as Dr. Gales was talking about. What gets lost in all this is, we think about the inconvenience for the customers who can't go to a bar and can't go shopping. You've got this workforce out there, which is in these rooms 8 to 10 hours a day, getting exposed to multiple turnovers of the population and everything they exhale into an atmosphere if their masks aren't on. And these people are really at risk. And to do this and not have a commensurate program to make sure that the people you're telling you're going to be the ones who are most exposed, even more than a typical customer, not to provide protection for that, that doesn't seem right. It doesn't seem fair.
Okay, last follow-up question will be from Caitlin Peets.
Hi. Well, while we're on the topic of schools, I figured that I can build off of that a little bit. Throughout the whole pandemic, since schools closed a year ago almost to the day, there's been a lot of talk among people about how important education is and how it should be prioritized in reopening plans. And, MCPS is still working on reopening. So you have some people who are concerned as there are more restrictions being loosened and would prefer to see the successful school reopening before these restrictions are eased. And, I was just curious, how heavily school reopening does weigh in these conversations, and if that was part of your discussion.
So, Caitlin, I'll just jump in as chair of the Education and Culture Committee. That certainly it was one of those things that weighed heavily in terms of how quickly we opened. It's the reason why we were more conservative. When you look at all the other jurisdictions throughout the state and what they've done, Montgomery County has been the most conservative, and that shows our commitment to making sure that we can ensure, hopefully, that our schools will remain safe places. We understand that it's much larger than our schools, unfortunately. And the reality is that what's happening in the community oftentimes trickles into the schools. And so we'll need to continue to do the things that you heard from the county executive and the council president when it comes, and from Dr. Stoddard and others, when it comes to commitments to wearing masks and social distancing and those kinds of things. And our measured approach, based on what the governor's order placed us in a precarious position, we had to do something and react in a way that showed that we were also understanding of the progress we've made, because we've been successful based on the numbers that we've seen and the commitment we've had to trying to control the spread, but also at the same time understanding that we have to balance that with some of the economic needs that we have. And so those are the parents and some of our individual school children, right? Some of our high school students who actually work in some of these places that have been shut down, that can no longer, that used to be folks who contributed to their household income and aren't able to do so any longer. You know, we have to be reflective of that also. And so again, it's a measured approach. It's one that takes an incremental step in terms of opening that allows for us to quickly react as well. And I think you heard that from Dr. Gales and Dr. Stoddard. We will be coming back to this in 2 weeks. And if we see the numbers and we see a slight uptick or we see things, then we can make decisions that are aligned with whatever the appropriate reaction should be. But, you know, this is one of those where I think that all of those factors that you mentioned were definitely weighed. And can tell you that we came up with a decision that I think still reflects our seriousness of what it is that we need to do in terms of continuing to reopen our schools safely and effectively, but also allowing for our community to move forward in a very measured approach that I think continues to focus on safety as well.
Thank you. Mr. President, that wraps up all the questions.
All right, we've worn everybody out. Thank you all so much, all the attendees here, for all your hard work on this. I think our residents are safer because of it. And thanks to everybody for joining us. And thank you, Ms. Kennedy, and everybody else that put this together. Really appreciate it. Stay in touch.